We'll bring on Dr. Peter Lombard, and we've had this transparency conversation. I mean, God, since the first lockdown with Dr. Lombard, and I mean, we sound like a broken record. If you guys don't know what a broken record is, just Google it. A skipping CD would be probably the modern equivalent.
It's an MP3 with problems.
Right. So, Doc, good morning, first of all.
Unmute.
Unmute. Don't you hate it when that happens?
Good morning, everyone.
Good morning.
Sorry about that.
No worries. Yeah, Doc, so here we are again talking about public health transparency. It never gets old.
Never gets old, and we never get tired about talking about it.
So what's your take on this latest? We reported on a large retail outlet that had, some spread among the employees. We confirmed with those employees, and Dr. Ho had also confirmed that one of the fatalities yesterday, the 41-year-old, was an employee of this large retail store. I mean, there's only how many large retail stores on island? So just, I mean, that being said,
Yeah.
Doc.
It's in Upper Dumont.
Yeah. It's an Upper Tumon. It rhymes with J Mart.
It's across the street from JFK.
Well, it's the first time I'm hearing this, so
Yeah.
just, off the top of my head, I think that every business here in Guam has been affected, and
Yeah.
it shouldn't come as any surprise that a large retail store has a few cases. So I think I just caught the last of that discussion with Dr. Nguyen, and what do owners and supervisors do in the workplace? And unfortunately, I mean, they're not necessarily trained or equipped to help do an internal contact tracing. If the best they can do is understand what a close contact is, find out which of their employees are close contacts, and instruct them to isolate until they hear further from public health. Because in the absence of doing anything, in the absence of doing that on their own, in the absence of telling all the employees about what's happening, in the perfect world, public health would be initiating that conversation with all the employees based on their contact tracing efforts. And we just know that that's not happening in a timely fashion. So I think for the business leaders out there, unfortunately, some of the responsibility does fall on you to try to do some of that initial contact tracing to keep your employees and your customers safe. Even the White House event, they apparently didn't do a very good job with tracing, and they're crowdsourcing people to try to identify everyone that was at the Rose Garden event. And it's sort of a community effort to try to identify all the potential positives, because a single positive can easily turn into a much larger spreading event. And it clearly identifies one of the weaknesses that we've talked about in what's happening in Guam right now is our contact tracing.
Right. Yeah, I mean, we hear from public health that, it's all great, but then I hear from people, and I don't know how anecdotal it is or not, but they're saying that, hey, we had somebody test positive. They didn't hear from public health for over a week. So a little bit of mixed messaging. I mean, what else is public health going to say? It's not like they're going to come out and be like, yeah, we're drowning with the contact tracing. I mean, they're just not going to say that. What they are saying is, yeah, we got it. Don't worry.
Well, I think it'd be nice if they acknowledge where they're, they could use a little work, where they could still, they're a little bit behind. It'd be better. I think it'd be better to hear that, show a little humility than just say everything's great, because we know it's not. And when we know it's not because of what we're hearing anecdotally, granted, but when we know it's not, then for them to say everything's rosy just smacks of, them not being as upfront. If they truly believe everything's great, then that says, well, maybe, they're not analyzing their data correctly, because it just doesn't seem that way from our perspective. And they haven't shown us enough data and analysis to show that their contact tracing is sufficient. And we get almost no data from public health outside of the reports. I think, I don't know if Dr. Nguyen mentioned it, but he had mentioned to me that they're considering making some pretty big changes to the JIC report, which will make it a little bit more transparent. And he actually asked for some input from the providers about what kind of information they like to see. So I passed along my requests, kind of the same stuff I recommended back in March for the type of data we'd like to see on the JIC report, and we'll see, maybe that'll help a little bit. But one useful metric on the JIC report every day would be to say, hey, how many positives have not yet been contacted by public health? I mean, you're having 60 a day. How many of that 60 have not yet been contacted, or within the past week of the 400 or so that we've had in the past week, how many of those have not yet been contacted by public health? That would kind of give us a useful metric. Now, give them a day or two, sure, so we can tolerate maybe 100 or so. But if that number is much higher than that, then that we're not getting to the contact tracing quick enough. And every contact, how many people are they going to? How many names are they going to give to public health that are going to require additional calling? It becomes exponential at some point, and you realize it's unfathomable how big of a job that is. And again, we all acknowledge how difficult it is.
Doc, we got some.
I'm sure they're doing their absolute best over there with the personnel that they have, but it's just not enough.
We got some charts from you. You care to kind of go into these a little bit? There's one here that's, I think, case age by week.
Yeah, so I've been talking a little bit about the ages, and I think it'd be kind of useful to see that in the graph form. I'm not seeing what you're looking at.
It's the bar chart, Jay. That one, yeah. Okay, well, we got it.
Know which one you want me to bring up, Pete.
Yeah, we've got it up, Doc.
Yeah, the age with the colors would be fine. So I've been trying to track the percentage of all our positives that are over a certain age, within all the age groups. Do you have that one up already? I'm not seeing it.
Yeah, we do. There's a little bit of a delay on the live stream, Doc, but we've got it up.
Oh, okay, gotcha. So, that kind of shows the breakdown of per age group, where these cases are coming from. And well, number one, it shows that cases are increasing week over week since really, we had over September, and certainly the first week of October, our cases are back up again. We're pretty much, had the second biggest week compared to our peak at the end of August. But if you look at the color coding there, the light blue is where the 50-year-old age group is, and then the yellow gets down to the 60-year-old. So you can see the percentage of all of ours over 60, and I'm calculating that out to be about 14 to 15%, and it has been increasing a little bit over the past few weeks. So not only are our total numbers up, but the total percentage of those over 60 is increasing a little bit as well. That seems to be fairly standard percentage, though. If I looked at a little bit of data from the U.S. and percentage of cases over 60, it's around 15% or so. So from that perspective, it's okay. What we want to see is more of that percentage in the lower age groups, and what has been happening typically in these second and third waves in other cities and states is that you see a much larger percentage of younger people the first few weeks of a surge, and then that translates to the older people, and that kind of makes sense because the younger people eventually, no matter how much we're trying to protect the older populations, it starts to spread into the older groups. So I think there's a mobility graph as well. I know Dr. Cabrera has shown this before, but just so people can see what we're looking at here, even with the PCOR1 lockdown in mid-August, our overall mobility only dropped to about minus 30% or so. And you compare that to where we were back in April with the first PCOR, we were down at 50% less mobility, at least by driving statistics, for weeks on end. So we never ever came down to the levels that we were, and that's why our numbers didn't go down to the levels that we saw in June and July. It's because we were still out there in too many numbers, and not protecting ourselves, in the workplace. And then we had a couple of spreader events, and that allowed the virus to get into the community too much. And what does this say? Maybe it doesn't matter what the stay-at-home order is anymore. People just aren't going to comply well enough to be able to get our mobility down in order to drop the numbers. And that has some implications for what we should expect in terms of the case positivities and numbers going forward. We're now at 60 cases a day on average, and 11% positivity. So.
Yeah, Doc. So that being said, what
the next slide I sent you there, Jason?
Okay. Yeah.
There's a chart about total infected
Yeah.
there too. The so this comes from a website that I've been following. This gentleman, his name is Yuyan Gang. He's a mathematician who's provided the most accurate estimates of infections that you can expect and deaths that you could expect in your region. And he, according to his calculations, he estimates that Guam is at about 21% of total infected to this point, and that's, I've mentioned that before. It's the only silver good thing, which is a paradox, is that despite the high numbers and the increase in deaths that we've been seeing lately, we're up to over 20% potentially, with pretty wide error bars. You can see, potentially as low as 11%, potentially as high as 35%. But right in the middle there, about 21% of our population is immune, for lack of a better word. So that has implications in terms of being able to control the spread, even though we're not doing, as good as we should be in terms of staying home and practicing social distancing. Perhaps just maintaining the status quo and even continuing to open up things, the numbers will stay where they are. Now, what can we tolerate with the hospital? I think 60 is barely tolerable. As you can see, the numbers at the hospital are barely tolerable. Once we get to 60 to 80 cases per day on average, our capacity will slowly exceed the hospital capacity. We'll have to start looking at those secondary sites and overflow contingencies again. And I think did you guys have any questions about that or comments?
No, go ahead, Doc. Last graph here: infection fatality ratio of COVID-19 versus seasonal flu.
Yeah, so I just wanted to touch on this briefly because there's various opinions out there about the how dangerous this virus is versus the influenza. And this was a really nice graphic because it didn't just cherry pick one or two studies, or it really looked at a lot of different studies, and even though their methods are a little bit different and the numbers they arrive at are a little bit different, you can clearly see there's a big difference in the fatality rate. Or basically, if you get the influenza, what are your chances of dying based on your age? And same for COVID-19. You can clearly see that across most ages, especially over the age of 30, you start to see this wide divergence. And it is definitely a much more fatal virus if you're to get it as somebody over 30. This may be useful to some people to try to see that indeed this is a much more dangerous virus to get. So. Just wanted to share a few graphics with you, change things up a little bit.
Thanks.
But I think there's also I think there's some ethnicity data out there that public health is looking through. It'd be nice to see that in terms of the folks that have died so far. How does that break down in terms of Asian versus Chamorro versus Filipino or Micronesian? I've heard anecdotally that the deaths are disproportionately affecting Micronesians for whatever reason, but without knowing more information about that, it's hard to speak as to why that might be the case. And same thing with these dead on arrival patients. They must know more information by talking to the families and friends and co-workers about what their last few days were like, and what lessons could we learn to help prevent these type of deaths, because you'd like to think that they're preventable, especially if they're in folks that are younger. They shouldn't be dying at the numbers that they are. Yeah. When you see folks in their 40s and 50s,
Doc, we have a few minutes left before the top of the hour, but I wanted to give you the floor. Routinely, when you come on, you make some unfortunate predictions. And so what are you anticipating within the next week or so as far as testing positivity rate, positive cases, and lastly, but definitely not leastly, the deaths?
Well, I think it's going to stay about the same. I think that the daily positive cases and the positivity rate is going to remain between 60 and 70, and the positivity rate will remain about the same. And that's only because of our overall prevalence is at the level that it's at. We're not doing anything to make it go down. Things have been we haven't made any changes out in the community that would impact this in the positive direction, unless there's things happening out there that I don't know about. I think, I appreciate you guys. Every time somebody leaves, you ask them, what's your message for the community, and that's wonderful. But I think that it's really confined to your listening audience, and I think that we need to do a better job about getting the message out to everybody. And it's some sort of public service initiative to get the message to people not to stay home if they're sick, to instill that trust in the hospital and in their medical centers that we're gonna help people if they come in. This is one, I think, fairly easy way that we can try to impact the number of deaths that we may see over the next few weeks. But because the numbers haven't changed, the deaths aren't going to change. We're going to see 5 to 10 deaths a week, and that's just the way it is, unfortunately. And to some people, that's acceptable as we march towards a higher percentage of immunity in the population. But to some people, that's unacceptable. We should continue to try to save every single life we can as this race to the vaccine, moves forward.
Well, there you go. The takeaways: deaths, high positivity rate, high number of positives. We're doing nothing to change that. Thank you, Doc.
All right, guys.
Well, have a good
Stay
weekend.
safe.
You too. Take care.
Wash your hands.
Bye.
Bye. There you go, Dr. Peter Lombard. He's been crunching COVID statistics since the beginning of the pandemic. And, as many times as we've had him on, he's usually, unfortunately, I mean, there was a time when I was happy he was right. Back when we were getting zeros and ones. Remember, he was